What's happening, y'all? It's Saturday. I just got done cleaning my little space and environment. Me and my girl, Cindy Kim, been working real hard on getting this content out for you guys. So today we're going to talk about what it's like as a home health nurse. So how I even got into home health nursing. I got done with being at the hospital. I did the homeopathic clinic. I tried some with the long-term care and rehab, and then I was looking on Indeed, and then after looking on Indeed, I found this open position as a nurse. Yeah, as a home health nurse. And actually, the official title for a home health nurse is actually a nurse. The official title as a home health nurse is actually nurse case manager. And they call you a case manager because you have a ton of responsibility. I started off, I had to take a test, and my boss, she hired me on. She was just so happy with the results that I got from the test. She thought that I scored, higher than a lot of people. And actually it was one of the jobs that I went to that they seemed like they were interested in me as a person. She just was like, I think you'll be great. It was just a really great fit. So she hired me on the spot. And once again, this is like my third or fourth job rotation at that point. She saw my history. She saw that I had worked at a lot of places. She asked me, she was like, what happened with my jobs and stuff like that? And she was very open to my responses. I told her, I was like, I haven't found the right fit yet. And I was telling her pros and cons to my last jobs. But she wanted to hire me, so she hired me on the spot. And I started working with them. She had originally trained me at a few houses and stuff like that. And then I got into the swing of things. So I will start with the cons to being a home health nurse. There is a lot of charting, but I think in all nursing there's a lot of charting. It's not even just charting, it kind of feels like you always have homework. So you go to a patient's house, and usually you have a tablet, or maybe you can use your phone. My company supplies me with a tablet, so I take the tablet to the house and stuff like that, and you do your charting there. There's a section at the top in Oasis that allows you to put in your vital signs. If it's your very first time ever seeing the patient, so you're starting care, they call it the start of care. If you're doing a start of care, those take a lot longer. You have to do a complete full assessment. You have to know the patient. You have to look at the documents that they got from the hospital or a skilled nursing facility, wherever they came from. So if it was a rehab facility they came from, they'll send you those papers over. If it's a program, if they just came from the hospital, they'll send those documents over. If they came from the VA, they'll send those over. So you look at all the papers that they sent over to kind of get a history of the patient and what's going on. You then take the information from there and you have to put it into Oasis so that it's an our type of universal system, because the hospitals, usually what they use is different than what home health uses. So you take all that, you enter you have to know their vaccination, you have to know what they're being seen for, what are their top priorities, you have to prioritize what their issues are. So if a person's problem list is 10 to 15 problems, you have to even categorize them in Oasis on a level 4 to a level 1. So you have to do a lot of Oasis documentation. You get their demographic, a pain assessment, a skin assessment. You do a full head to toe assessment, and it has the categories that you'll fill in. You have to know what kind of breathing issues they have. It's a lot. So that first initial assessment, it's a lot of important details. And then you also have to form your interventions. You form how long you're going to be doing these interventions for, and you actually have to be following through with these, because each time that you go back on your visits, you have to make sure that you're checking off your interventions, make sure you're doing this, because you are with these patients for anywhere from 2 weeks to sometimes to 9 weeks is one certification period. Then at 9 weeks, you can either recertify them if Medicare, Medicaid, or the VA, whoever their insurance is, if they allow it to be recertified or check for recertification, you recertify them again. sometimes you can discharge them early so you can stop with their care if they heal. Like for example, one of my diabetic patients, he had 2 huge wounds on his leg here and on his other leg. So I had orders from the doctor, from his primary care doctor, even though he had left the hospital. I got orders from his primary care doctor to treat his legs. And so every single day or every other day that I would come over there, I had to try to heal his legs. And he healed in like, not even, I don't know, maybe 4 to 6 weeks or something like that. So just these last couple weeks, I'm just going to see him about once a week just to make sure, you know, everything's still going good. So yeah. It kind of sucks with the charting and stuff like that you do. Sometimes I forget a lot of stuff that I do with them, and then you don't really want to chart everything because say you guys have a really personal conversation. Some of my patients that suffer from a little bit of like mental, not issues, but like everybody goes through things. So I have patients that are going through like depression or anxiety or stuff like that. We might have some one-on-one talks that I might not put all the way on the paper with, but I'll put something like patient expressed to me feelings about certain issues that he was having, you know, so that's an intervention towards anxiety, that's an intervention towards depression. So being a home health nurse, being a nurse coordinator, case manager, you have to know not only about everything that's going on with your patient, you have to know about who you're responsible for physical therapy, occupational therapy, social work, keeping track of those things. Some patients, they need physical therapy. Physical therapists are going to come in and help the patient move better, work out and exercise. Occupational therapy is going to help patient do daily activities. Is he able to brush his teeth? Is she able to take a shower by herself? And why? Why can they or can they not do those things? So what do we need? What do we need to send to the patient's home to be able to help the patient heal, live better, and ultimately have a better health all around? So the charting kind of sucks, but one positive side to that, I just recently went out of town, so I was able to get caught up on my charting while being out of town, being on the road or being on the plane or something like that. So you do kind of have freedom. It's kind of like you're always doing homework, which if you're fresh out of school, maybe that's not so much of a bad thing for you if you exchange that little bit of that some freedom at home. Some people like 12 hours because you go to work and you're there at work and then you leave home. As a nurse coordinator, you can't just take your job away. I'm constantly getting calls or callbacks from a doctor's office that I've called, from a hospital that I've had to call and get some more information, from pharmacies that I've had to call about medications. And then you're always going to be thinking about your patient. So I'm always wondering, like, is that patient being safe at home? Are they not having a fall? Did I teach them? You go back and you're like, did I teach them well enough about their medication, about the interaction? So being a home health nurse, you kind of always feel like you do have a closer relationship with your patients, and you kind of feel like they kind of become like almost like family to you. So I feel like as a home health nurse, maybe you might find yourself a little more invested in your job, but you're a case manager, so it's a little bit of a higher level of position, a higher level of responsibility and a role that you do have to take on. So kind of the process of how you do it. So being a home health nurse, there's full-time and there's part-time. I started off full-time. So full-time, you could be seeing up to 30 patients in a month. And that it got extremely stressful for me. I had a car accident. I had to take a couple weeks off and stuff like that. So when I started back, I started a part-time, and it was a lot better for me because I do so much outside of work. I wanted to be able to make sure that the people that I had, I could really focus on them. So right now I'm seeing one every single day. I just got done seeing one 3 times a week, so I moved him down to 1. I'm seeing another one who I see 2 people about once a month. And I just started 2 new people, so that's 7. And then I'm seeing another woman. I see her twice a week. And then I just started this new guy. I didn't start his care, but he got moved to me, so I kind of helped him with another nurse. So I guess total I have 9 patients. But right now I have 9 patients. Tomorrow I could get a call from my boss and she say, hey, we just got blah, 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 so-and-so just came. Can you take this patient on? You can choose to say no. You can choose not to do it either. But I mean, you want to help out your company, and you don't want to just get so caught up in your own life that you're like, no, I can't see this patient. So you want to kind of give and take. Even though I work part-time, sometimes my week might look like a full week full-time. So it kind of just depends, as much as you can take. I don't like to take more than I can handle, because it's the patient first. And every time you go into that home, you have to be ready to take care of that patient. You can't be worried about what you're doing outside of your life. And so when I'm starting someone on service, I guess, how long does it take inside of a person's home, right? That'd be a question somebody would ask me. When I start care with someone, I block out about 1 hour to 2 hours. Could up to be even up to 3, depending on what the person has going on. So that initial assessment kind of takes longer. You have to make sure you sign your documents, that you can start care. There's a lot of teaching that goes involved in that very first initial assessment. If they have an IV, there's a lot that you got to do with that at first. It's a lot. There's a lot of assessments that you have to do as a home health nurse. You have to take their wound dressing off too. Some of my patients, they have an IV plus a wound vac, lacerations on the head. You get all types of things. I did someone who was getting feedings as well. So you get it all. So that first assessment can be kind of long, but after that, it usually gets better. Each bit, as you start to know your patient, you know what you're going there for. So maybe the visit will start to get cut down to about an hour, maybe 30 minutes. You can't go less than that. So if they need less than 30 minutes, then maybe they don't need services with you. So most of the time, it's at least 30 minutes. I'll find something I could teach them or help them with. So yeah, that's how long visits usually are. And then you can see a person one time a week, all the way up to every single day of the week. I have a person getting antibiotics, so I have to switch his bag every single day. One thing about being a home health nurse too, that I was not prepared for as a home health nurse, is that every home is different. I could go from a house in the suburbs to, they got 3-story buildings and it's super clean, and I wish I could spend all my days there too. You know, some of the more uncomfortable homes and the more uncomfortable neighborhoods. But you don't judge, right? You go in that house, and every single look, you put it on your face, and you look like you're in a 5-star lavish hotel, because it's not their fault. Well, a lot of times it's not their fault that they were there. Life happens, right? So you can't judge a person based on their home, and everybody needs their help, and everybody needs the treatment. So if you're not ready to go in uncomfortable homes, don't do it. Something else I wasn't prepared for, you got to deal with family. So I remember sometimes I'd go into a person's house and I'd be treating them the patient, and the next thing I know, there's like 3 or 4 family members in there, and you got to be able to still handle yourself, still do your nursing stuff while you got 3 and 4 other people watching you. And then being with the person's house, right? You come in, and at the hospital it's different. You got a personal table that you can pull out, put all your little nice nursing supplies on there, and make sure you're keeping sterile technique. What if there's no clean table for you? What are you going to do to make sure that you're going to be as sterile as possible? Are you willing to clean off your table? Are you willing to, So there's a lot. One big thing you do as a home health nurse is medication management. So you might be filling pill boxes for patients. So I learned more about medications and stuff like that, teaching them about that. So you do that as well. So you have to be careful about the narcotics. You have to be careful about making sure that each pill box is filled the correct way. I've had to mix and match pill colors because one of my patients decided they wanted to fill their pill box without me, and so I'll look and I'll be like, so you'll have to take, without wasting medication, because you can't, you got to take each pill out and find out, okay, this one for sure looks like this one. Okay, no, now let me tell you, let me teach with you next time. So you got to find ways to talk to your patient. One other patient I had, super, not mean, but she was very, very rude. So you have to learn how to deal with people who might not always be the most nicest to you, but when people are sick, nobody's really in the best mood always stepping in there. But that's one thing I like the most about it. I'm in their environment. I get to heal them in their environment. And I know what they're using every single day, so I can go. I'll go in the house and I'll look. Okay, they got these type of foods on their table. They have they live like this. I can find out quick how a person lives, and I can be able to adjust. Oh, they're not a fruit eater. Maybe I shouldn't just constantly. Maybe I should gradually teach them how to eat certain things. Or they're not. They don't like to get up a lot. They don't really like sunlight a lot. I'm gonna have to teach them. So it's a lot. Let's talk about pay, because everyone does want to talk about money and pay too. Personally, I feel like you do get paid more as a home health nurse because you go and you dedicate an hour of your time to, say you go and dedicate an hour of your time, and usually most companies will give you like, they could give you anywhere from $25 an hour or $25 per visit to $100 per visit. So, I mean, if you're doing 8 visits a day, and say you're making, let's say 50, because it's such a, you know, or let's say 100. So say they pay you $100 per visit, and you go out and you do 8 visits, and it takes you 1 hour. Some might take 30 minutes or whatever. I know nurses who have done 8 visits in a day, and if the company did pay $100, that's $800 in one day. What I like, my most enjoyable things that I like about a home health nurse, other than being able to heal them in their environment, in their home, you kind of build close relationships with the patients. So, you know, they kind of get your personal number if you don't have your own number for it. You get to learn new cultures, new family members. You get to see different, I love like house looking and like interior design decoration, exterior. So you get to see like different type of designs of what people like how they like their homes. So that's kind of cool. I love the independence of it. You don't have someone always on your back that's like, you got to do it like this, you got to do it like this, or watching you. I kind of feel like I work a little bit better independently. So having that freedom to go into another patient's house, having that freedom to not be so surrounded by other people, that if you're having a bad day or something like that, you get to be in your own little zone. You make your own schedule. So say you have to see a person twice a week. Well, unless they need, like, you have to kind of manage it, because you don't want to just see a person twice a week and you see them Monday and Tuesday just to knock it out. But if there was a reason that you couldn't be there, or if you had to move something in your schedule, say you had like a 9 o'clock, something to do at 9 in the morning, and you couldn't move that thing that you had to do, well, your patient can be moved to 4 if it's good with the patient. So you get a little bit more freedom in your schedule. And I think part of like not having to be around like some of your other coworkers all the time, it's easier to build that relationship with them. I can talk to my physical therapist, I can talk to my occupational therapist, and you kind of know there's only like maybe a few of them too. So you familiarize yourself with your team. We have meetings and stuff like that once or twice a month to keep everybody kind of on track with it as well. One thing I liked about being a home health nurse is that I got to be outside during my shift, and I like would be able to listen to music in my car, because being them 12 hours, like you never even get to step outside or anything like that. And I'm such a sun baby. It's like when I don't see outside, it's daytime, I get so upset. Most of the patients that you see, they're kind of homebound, meaning they really can't get out of their homes for whatever reason. It's nice that they can still have someone who comes to them to come and help them. That it's your responsibility to make sure that you're doing the things that you need to be doing, trying to keep those clean and sterile techniques. You need to make sure that you know your resources. So you should be very familiar with your manager, you know, because that's your first line of call. Like if you don't know something, luckily I have one. She's really cool. So anytime I need anything, or anytime I don't know how to do something, I'm calling her. I would say know who your patient's doctors are. I could do a little bit better job of that, of knowing, like, because the patient might have 4 different doctors. So having like a written thing out, like, okay, doctor blah, blah, blah for this reason, doctor that for this reason, and having them on speed dial, having the pharmacy on speed dial, those things kind of help. I've only been doing it for a few months, so of course, like, there's always room to grow. But I feel like home health nursing, I really like that. It's been one of my favorite ones so far. As a surprise, you know, I'm taking my first travel assignment. I'm not ready to disclose it yet, but I just accepted my first travel assignment, which I'm really sad because I really like the company that I currently work for. But it's a 6-week assignment, and I kind of want to go to the hospital and go refresh on my steps, because a benefit about being in the hospital is you're doing the same thing every single day. So it becomes like clockwork, and you know how to do it. And as a home health nurse, one of my patients I'm doing wound treatment, another patient I'm doing IV therapy, another patient so I'm doing like a bunch of different things, not necessarily getting the same thing each time. So being at the hospital, it does help you get a lot of repetition of a bunch of things at once too. versus the once or twice or however I'm doing it a week. So yeah, so I'm gonna work for 6 weeks on med-surg floor, kind of just brush up my skills again and be around some other nurses. I like the change and to be able to do different things like that. So yeah, before I go, I just want to shout out my little Creative Souls company t-shirts. This is the sleeper tee. It's almost finished. I'm gonna have another little prototype for it. Almost finished, but stay tuned for Creative Souls clothing. That'll be dropping soon. Stay tuned for With Love, My Love, that project release, my first official album, mixtape, EP, whatever you want to call it. That'll definitely be on YouTube as well. And if DistroKid doesn't mess up my timeline, it'll be on Spotify, Apple, iMusic, or Apple, you know, all those things. But definitely check YouTube first. What else? Make sure you guys like, subscribe, comment. Yeah, I think that's it for today. I'm really hungry. We've been working all day, working all week, working all night, working all weekend. So it's my birthday dinner tonight, and then I'm gonna have a listening party with my auntie and my best friend. So yeah, I'm about to go enjoy myself tonight. Thank you guys for watching.